Welcome to meeting number 8 of our weekly EMA talking points to update you on the community response to COVID-19. Tim Richmond with Wapello County Emergency Management. And with me tonight, I have 3 panelists that represent our electorate. So with me is Mayor Tom Lazio, that is going to speak about transparency and the role of government during disaster response. Also with me is Kelly Spurgeon, our county auditor, who is also the commissioner of elections. She will speak to us about election expectations for the upcoming June primary and help you understand how you can access your ability to vote. And finally, Supervisor Jerry Parker, that will review with us the current proclamation and what the governor has outlined in terms of lifting some of the restrictions that we've experienced for the last several weeks. First, I just want to go over with you some notes that I have and then discuss with you some kind of behind the scenes notes from our local healthcare coalition that really is the driving force behind our response. Last week, a federal initiative drew a new blueprint for states to scale up their testing for COVID-19. States have been encouraged to develop their own testing plans, thus developing internal capabilities to pinpoint and respond to the current outbreak and to monitor future outbreaks this summer and beyond. With the ability to expand these testing capabilities within the state, guidelines on who can be tested have also expanded, allowing local healthcare providers to better assess rates of infection in our communities. Wapello County Public Health has stated, quote, in response to changing testing criteria and testing capabilities, the number of confirmed cases in Wapello County has risen sharply over the past week and will probably continue to rise as expanded diagnostic testing becomes an integral part of the effort to contain the coronavirus, end quote. The Wapello County Public Health Department and Wapello County Emergency Management are working proactively with state partners, community leaders, business and healthcare partners to assess the presence of COVID-19 in Wapello County and mitigate the spread through the supply of PPE and education on proactive cleaning, personal hygiene, social distancing, and isolation measures. I want to elaborate the importance of staying calm as the number of positive cases potentially begin to rise. Every one of us has already been impacted in some way by this virus. Some people are no longer working. Some have to homeschool their children because of school closure, and others are going store to store to search for toilet paper. The change in our life due to COVID and the apprehension of the unknown brings a sense of panic because we don't know what lies ahead, whether involving infection from the virus itself or the economic and social impact. Many people are on edge. But the key is to remain calm. As people read the news of more positive cases in Wapello County, they become anxious. That doesn't mean we should ignore what's going on, but we should keep in mind a more accurate picture of illness in our community allows for better collaboration with community leaders, business and healthcare partners to further develop our core capabilities to track, mitigate, and confine the spread. Public health also reinforces the need for citizens in our community to remain calm but trenchant. We all need to stay calm, wash our hands, and take other preventive measures. Continue to social distance when possible, stay home when you're sick, and know that every day that many people are working together to protect the safety of our community, doing our very best to track and report the most current, accurate number of positive cases and guide the public on how they can stop the spread of COVID-19. So I want to talk a little bit about that. Behind the scenes, even way before the outbreak reached the United States, we've had a group of people in Wapello County working together known as the Wapello County Healthcare Coalition. And those are comprised of literally every aspect of healthcare in our community, from our hospital to long-term care facilities, our clinics, dialysis center, emergency medical services, private practice. All of those partners meet on a regular basis to do preparedness planning, have conversations, build relationships. That type of preparedness activity has paid off in this time of response. And that's why we do those things, frankly. So it is that group that has been making decisions behind the scenes to frame and shape and drive our community response. One of those products that Edward here will put up on the screen was a flyer we've published, distributed print versions, and continue to push out that helps you identify our local clinic system. That would be that other graphic. You want that graphic? Yeah, that red one, please. Our plan, our mitigation plan, initially and still is for us to provide you initial access to a primary care provider to talk about your symptoms. So if you have symptoms that you feel are COVID, related. So the shortness of breath, cough, and fever. We encourage you to call your primary healthcare provider. If you do not have a regular healthcare provider relationship, you're welcome to call any of the clinics listed on this flyer, and they will be happy to assist you. If your symptoms are very severe and you feel it is more urgent than that, you're always, of course, encouraged to call 911 or access the emergency room. But if they're not severe and you feel like you can talk to someone and get some questions answered, that's absolutely what our clinic system is for. That has been working extremely well these past several weeks, and our providers are very happy to step up and do that for you. We really regard that process as a total community response, and we want to continue on that path to be able to handle the flow of need and not overwhelm our emergency department so that we can reserve the hospital for our most acutely ill, because other illnesses and conditions will still continue to be present in our population. Next, I'll talk about the source of information. So if we could switch back to the website. WaPaloReady.org is the emergency management website. We're using that as our common platform. Emergency management's role to step up and assist public health with messaging and reporting and transparency for you, the public, will all be done on this webpage. We've revamped the website about a month ago to bring you the most relevant information about COVID and to take the massive amount of information that's out there and make it easy to understand. If you go to our main page and you scroll down a little bit, you'll see the most current information. We first talk about the Test Iowa initiative that you hear the governor speak of. We encourage you to take that assessment because it gives us a statewide snapshot of what type of symptoms we're seeing out there. And then next you'll see the report on the cases here in Wapello County. And our goal is to have that updated at 10 a.m. every morning. If we're a little late, that's because there's probably going to be a big number reported like there was this morning, because public health behind the scenes is following up with each and every one of those cases reported. And if there's a discrepancy, like we do have right now, between our numbers and the state numbers, understand that the state is aggregating numbers for the entire state. They're not doing the follow-up. We're doing the follow-up locally. And so our numbers are going to be the most accurate. And we do keep track of that each and every single day. So that will be the best way to help everyone understand what's truly going on, to dispel any rumors. We encourage you not to make assumptions that are not true. Come to us as your local source, and we're going to be open and honest with you, and ask us questions that you need the answer to, and we'll be doing our due diligence to bring you the right answer. So to continue on that thread and topic, I'm going to turn it over to Mayor Lazio.
Thank you, Tim. Appreciate the opportunity to visit, and want to say personally, I appreciate the leadership your office has shown in this pandemic, and the fact that we can rely on you for good information. Governmental transparency promotes accountability and provides information for citizens about what their government is doing. That's why all the decisions that we make are made in the public and voted on in the public. The benefit of providing as much information to the public as possible is that it gives the public an opportunity to think critically about the decisions made by local officials. This provides comments and feedback, which are an opportunity for two-way communication between agencies and our constituents. The value in two-way communication is that it shows that the local government is listening and responding to the community's needs, and that the public is very much invested in their community. Local governments are continually looking at how to improve the quality of life and safety for citizens. While transparency is the key in informing the public, sometimes requests for transparency can't be met due to privacy and/or disclosure regulations. Misunderstanding of why information cannot be disclosed has a tendency to result in speculation, misinformation, and distrust. Thus, communication can break down pretty easily. The responsibility of two-way communication works both ways. While the government and its departments need to be transparent, the community has a responsibility as well. The public's right to know must be carefully balanced with the protection of individual privacy. A degree of trust must be given from the public with the understanding that their governmental agencies will serve and protect public safety in a way that aligns with the protection of individuals. And a good example of that would be the HIPAA requirements. With increased testing and economic relaxation, Wapello County residents will be seeing more positive tests in our community. Local officials are working collaboratively with healthcare partners, businesses, and emergency management and the local public health agency to identify and track cases of COVID in our county. These agencies are required by law to report all positive cases and their ages to the public. To protect the privacy of our sick citizens, some of the information such as name, healthcare status, hospitalization, or place of work cannot be made public due to privacy laws. Follow-up information obtained in tracking is relayed to the appropriate contacts. It is the responsibility of the public to be patient, follow recommendations the best they can, and instead of speculating or distrusting, ask good clarifying questions with the knowledge that not all information can be made public. As mayor, I want to reassure you the number of positive cases rises in Wapello County. Your healthcare officials, our providers, businesses, emergency management, and local public health have been working diligently to make sure preventive measures and mitigation strategies are in place to protect the health and safety of all residents. Even with relaxed restriction, it is still the responsibility of the public to stop the spread of COVID-19. We do that by continuing to follow recommendations for public safety. You can patronize reopened business, assume attendance at houses of worship, and frequent public library, but you must remain vigilant and observant of measures that prevent the spread of this disease. Our individual response is key in making sure that the number of positive cases remains manageable and the health and safety of Wapello County residents is protected. So thank you very much, Tim, and we'll look forward to more discussion with you.
Thank you, Mayor. And one of the key functions of our government is the election of our officials. And to talk about that topic is our Commissioner of Elections, Kelly Spurgeon.
Thank you. So first off, I just kind of want to go over some things that we've changed for Election Day. We all know the election is going to be June 2nd of 2020. The polls will be open from 7 a.m. to 9 p.m. We have reduced our polling locations from 22 down to 9. We will be using Great Prairie AEA, American Legion, Bridgeview Center, Hickory Grove Church, Indian Hills Community College, Blakesburg City Hall, Agency Community Center, Eddyville Library, and Eldon Library Hall. I'm excited to announce that we do have a new Wapello County Elections webpage that has any information on there that you would need to find out about the election. It has absentee ballot request forms, voter registration forms. It lists all the polling places. We have copies of sample ballots on there. Voter registration statistics. And we do have the capability of putting election results on that webpage on election night. So I'm excited about that. We have taken precautions in providing our election workers with masks, hand sanitizer. We'll be cleaning the polling places, wiping down the counters and stuff. We have also bought extra pens for marking your ballots with. So each voter will get a pen, and then they can keep that when they leave, so we don't have to be handing those back and forth. Like I said, on election night, all the same procedures that we followed before will follow during this time, except for with reduced polling places. And all those polling locations is available on our website, which is wapelocounty.elections.org. And you can go on there to find out if you're in precinct 1, 2, 3, then you would go to Great Prairie AEA. So we're not limited with elections by the number of people that you can have at a polling place. And everybody knows that you should at least stay 6 feet apart. And we will try to, on election day, mark out some spots. But I know we've been having problems finding tape to put on the floor. So I kind of want to go over some things for absentee voting. I know you've probably all received an absentee ballot request form in the mail from the Secretary of State's office. They're trying to push for voters to absentee vote instead of going to the polls. Just so everybody won't be, if there's a they're not going to be out there exposed to everything. You can just vote in your home. And the postage is paid. So when you return your absentee ballot request, you don't have to put postage on that. I know we have received several phone calls since people have been getting them in the mail stating there's no envelope to put the request in. It has our driver's license number on there, our date of birth. If you want to, you can just refold it where our address is on the outside, tape 3 sides of the form, put it back in the mail and send it to us, and then all your information is enclosed on the inside. If you did not receive an absentee ballot request form in the mail, you can write on a blank piece of paper your name, date of birth, driver's license number, or your non-operator ID, or if you don't have either one of those, your 4-digit PIN number, address where you live, mailing address if it's different than your home address, the type of ballot you would like, whether it be a Democratic ballot or Republican, sign and date it, and then mail that to our office. And as soon as we receive that request, we will mail you a ballot. The last day to request a ballot to be mailed is Friday, May 22nd at 5 o'clock. So if you want a ballot to be mailed to you, we have to have that request by that time. And if you're returning your ballot by mail, it must be postmarked June 1st in order for it to be counted if we receive it after the election day. On Monday, May 4th, we will be opening up the courthouse for in-person absentee voting. All other offices in the courthouse will remain closed. And the only office that will be open is our office for voting. And you can vote between the hours of 8 and 4:30. And you also can return your absentee ballot to the auditor's office on election night. We just have to receive it from you before the polls close at 9 o'clock. I would also like to let the public know that we will be open on Saturday, May 30th, from 8 to 4 for absentee voting. I also wanted to touch base a little bit on voter registration. The pre-registration deadline is Friday, May 22nd at 5 o'clock. If you are not registered to vote by that day and you go to the polls on election day, then you would have to do election day registration, which means you would have to show proof of identity and proof of residency. If you do not have either one of those, and you know somebody that's at the polling place voting, you can ask one of those people to be your attester. If nobody there that can verify that who you are and where you live, then you would be required to vote a provisional ballot, and then you would need to supply us with proof of identity and residency by the 4th, June 4th on that Thursday. And you can also register to vote if you're 17 years of old and you want to participate in the primary election, you can do that. The only thing is you have to be 18 on or before the general election to vote in the primary election. So I think that's probably kind of everything in a nutshell.
And if anybody has any questions, feel free to reach out to the auditor's office. They'll be glad to answer your questions. And I can tell you from working around the gals in Kelly's office, it's very busy in election time. But it's such an important function for us as citizens. And I know Kelly is always encouraging everybody to make them more busy, utilize your right to vote, and take advantage of the absenteeism ballot option. And they'd be glad to facilitate any questions you may have. Next, we have Supervisor Parker that will help us understand what the lifting of restrictions means and give us some good reminders on what to continue with in the next month.
Well, you're probably all familiar that the governor has somewhat relaxed some of the restrictions. Some of the restrictions for businesses, malls, fitness centers, libraries, churches until May the 15th. The thing to remember is these are partially open. They're not back to business as usual. We're still supposed to maintain safety as far as distance. They're doing cleaning, extra cleaning, and that's the increased hygiene is to protect the public and to protect the employees. We need to really balance this opening with community safety. If we just jump into it and say, oh, things are over now, we're going to get back to usual. No, we're not there. You need to remember that there are certain people that have extensive problems. You know, a lot of people, most people recover from the coronavirus. However, if you're a person with a pre-existing condition, don't jump the gun, because your chances of recovering are less than a lot of younger folks who are in good health. If you're over the age of 60, no sense jumping into this, because you're one of those people in the group that you're not going to heal as quickly, if at all. Remember what class you're in, pre-existing condition or over the age of 60. Don't look at, okay, everything's open for me now, because it may not be. There are certain things you still should do. You know, stay at home if possible. If you don't have to go out, don't go out. You need to wear a mask. You don't look silly. You look smart if you're wearing a mask. If you have to leave home, don't take your whole family with you. No sense exposing yourself and the kids and mom all to a hazard. You know, it's best to leave the family at home. This is going to get over, and you'll be able to go somewhere together if you've been careful during this time of the virus. Wherever you go, you're going to meet people you haven't seen for a while. Stay 6 foot apart. Don't shake hands. Don't run up and hug somebody. It's just not worth it. You'll get to do that probably in a few months. And if you're sick, stay at home. No sense making it worse for yourself. No sense making it worse for other people. So stay at home. You may only be seeing a few minutes of this right here, but they can tell you, we started talking about these things early this morning. So this is not something that 5 minutes before this meeting, we decide, well, what do we want to say? We've been looking at what was the appropriate thing to say all day. We're in this for your protection. Now, at the courthouse, we're asking you to be patient. We want to provide services for you, but there is not a single service that you need that is worth you getting sick or putting a family member in jeopardy of being sick or even death. Now, you heard what the auditor said a few minutes ago. We want to remind you, the courthouse is not open Monday. It's open for absentee voting only. What we want to remind you is, don't think, okay, I'm going to go vote absentee, and while I'm there, I'm going to stop by the treasurer's office. You will not be able to. There will be a locked door, and it's for your safety. We're making some improvements at the courthouse during this time, that once these improvements are completed, it'll enhance the safety of our employees and the public. For us to accomplish this, and we're doing it for one reason, protect people. If you're not patient and you don't allow us the opportunity to do this, you put yourself, your family, and the employees at the courthouse and in the county, you put them in jeopardy. The key words here would be patient. It is going to get over at some point, and things will be back to normal. But until then, don't put anybody in jeopardy. Let's follow the rules and let's be careful. Don't leave home unless you have to. Thank you.
Thank you. And I want to thank all of my panelists tonight. It's a pleasure to represent and serve them as your elected officials and execute their duties in this time of disaster. And I want to remind you to utilize our online resources mentioned tonight, wapaready.org and wapacounty-elections.org, correct?
Yes.
Yes. Or phone any of our offices with questions. We're at your service. I also want to thank some people in the room that's behind the camera that serve very much with us every day. Heather Severson is our public information officer and writes the pretty words for us and does a tremendous amount of work in our Emergency Operations Center. And Edward Wilson, who is the IT director for the city of Ottumwa, that is the brain behind the mechanics to do this live feed and upload to our YouTube channels. And we couldn't do this forum without those two individuals. We'll continue doing this every Thursday at 6 o'clock, as we have been doing for the last 8 weeks. as long as we deem necessary and we have folks with relevant information provide for you. And we're all ears to your questions and requests for topics to talk about. With that, we'll sign off for the night. Good evening and wash your hands.
Good job.